Welcome to our guide on pediatric pharmacology. Today we're diving into the important topic of drug dosing and calculations for children. Children are not just small adults, and their bodies process drugs differently. This means that drug dosing in pediatrics is a careful and precise process, tailored to each child's unique needs. When calculating the correct drug dose for a child, we consider several key factors: age, weight, body surface area, and organ maturity. Most pediatric doses are based on the child's weight in kilograms. This approach ensures the dose is appropriate for the child's size. For some medications, particularly those with narrow therapeutic ranges like chemotherapy drugs, we use body surface area or BSA to calculate the dose. This method provides a more accurate dose for these sensitive medications. In pediatric pharmacology, the principle of start low and go slow is crucial. We begin with a lower dose and adjust it based on how the child responds. Children often metabolize drugs faster than adults, so they may need more frequent dosing intervals. Medications for children usually come in liquid forms, chewable tablets, or dissolvable formulations to make them easier to administer. Let's look at how we calculate a pediatric dose using weight-based dosing. If a medication is prescribed at 10 milligrams per kilogram and the child weighs 15 kilograms, the dose would be 150 milligrams. Another method, Clark's rule, adjusts the adult dose based on the child's weight. If the adult dose is 500 milligrams and the child weighs 30 pounds, the child's dose would be 100 milligrams. We must also adjust doses based on the child's renal and hepatic function, especially in newborns and infants, whose organs may not be fully mature. Let's consider acetaminophen, a common pain reliever. The recommended dose is 10 to 15 milligrams per kilogram every 4 to 6 hours, with a maximum of 5 doses in 24 hours. For a 20-kilogram child, that's 300 milligrams per dose. For antibiotics like amoxicillin, dosed at 25 to 50 milligrams per kilogram per day in divided doses, a 10-kilogram infant prescribed 25 milligrams per kilogram per day would need 83.3 milligrams per dose 3 times a day. Scene transition. Regular monitoring is vital, especially for drugs with a narrow therapeutic range. We must keep the drug within the therapeutic range to avoid toxicity. Educating parents and caregivers is essential. They need to understand how to administer the medication, recognize side effects, and know when to seek help. Ensuring safe and effective drug dosing for children requires a careful, individualized approach. By considering each child's unique physiology and closely monitoring their response, we can achieve the best outcomes in pediatrics.